welcome. I am Kimberly Jones, co-chair of the Veterans Alliance VRG Events and Communications Committee, proud Air Force veteran, and moderator for today's session. Before we get started, I just want to point out a couple of housekeeping items. All attendees are on mute, but we certainly encourage folks to type their questions in the chat box, and I will do my best to gather all of those questions throughout the presentation. As just a general heads up, today's session is being recorded and will be available to review at a later date on the VRG website. Now, as tradition, we'd like to start out with our quick audience poll. Paul, would you please launch the poll at this time? We're asking, which branch of service did you or your family member serve in? Let's see what the audience makeup is today. It's most of the time Army wins out, and but I'm hoping that Air Force is a close second. Yeah, it looks like we're at 56% for Army, and then Air Force and Marines are, and a Navy. We have a three-way tie for second. That's interesting. Okay, I'll take it. I'll take it all day long. Thank you so much, Paul. Again, thank you for everybody for attending. I am so pleased to present our speaker for today's Vet Talk, Miss Andrea Lewis. Andrea Drea Lewis served honorably in the U.S. Navy for over 20 years and retired as a Navy corpsman. Upon transition, she continued to serve as a veteran care coordinator for combat veterans suffering from symptoms of traumatic brain injury and post-traumatic stress. Her work with veterans inspired her to join the North Texas Veterans Health Administration in 2019, where she serves as a veteran program outreach specialist in the Office of Communication and Community Engagement. As a veteran, spouse of a veteran, and daughter of a veteran, she continues to serve her community with the utmost commitment to veterans and their families. So without further ado, Drea, the floor is yours.
Well, thank you so much, Kimberly. Thank you for the invitation of being able to come in and share some information about veteran affairs. I look forward to this presentation, hopefully many more. And without further ado, we do have a few of my colleagues that are also here from VA who also will be sharing some information as we go along. And so I'll go ahead and get started now. All right. And so quite often when you hear someone talk about VA, we don't know which VA they're generally speaking of, because it could be one of three administrations. And so when we say VA, we're speaking of Veteran Healthcare Administration, the Veteran Benefits Administration, as well as the National Cemetery Administration. We like to say it's one VA, but three administrations. And so with that said, we understand that VBA, as we call it, Veteran Benefits Administration, handles the compensation, things that you've already heard of, or maybe even used before, like your home loan, educational benefit, potentially voc rehab, or enrolled in the insurance policy. For veteran healthcare, it covers all of our medical centers. So here for North Texas, we have our Dallas Medical Center. Garland is our newest medical center, and then we also have Bonham. And with that said, VA North Texas covers 40 counties, 38 here in North Texas, and 2 on the border of Oklahoma. So not only do we have those medical centers, we also have what we call CBOCs, or community-based outpatient clinics. So those are your clinics like your Plano Clinic, maybe Grand Prairie, Fort Worth, and a few other in Denton, and more that they're looking to add in the near future. And most people don't know, but also if you've ever heard of a vet center, or visited the vet center, or maybe seen the mobile bus, those are VA employees as well. And then last but not least, our national cemetery. Quite often people kind of shun and not want to go and get that information, but it is a benefit to us to have that information readily and available so that our family members have it and not have to try to figure things out. And so we'll have someone here to share some information on that today as well. So when we're thinking about just simply eligibility for VA healthcare, there's sometimes this myth. We see it in different forms that anyone that's ever served, no matter when they serve, where they serve, or how long they serve, they are absolutely eligible for VA healthcare. And that's not always the case. So we love sharing this information so that we can make veterans and their family members aware that the veteran has to be separated from active duty service in order to enroll. There is a process in place with our transition team that seamlessly helps with that coming out of DOD into VA, but also our active duty service who have been discharged or released under conditions other than dishonorable, also are eligible for care. We have our reservists who have served on active duty or in an operational support setting, excluding the 2-week training, right? And then our National Guard members who we don't like to forget about, been mobilized under federal orders, or VBA will be able to explain a little bit more what are other ways in getting service connected that would allow a National Guard member to be able to be eligible for veteran health care if they have not or was never mobilized by a federal order. And so VA provides it used to be 5 years. I highlighted that because many people don't know that 5 years now is 10 years under what we call the PACT Act for enrollment. It broadened the spectrum of care for combat veterans so that instead of having 5 years, they have 10 years now. And I know you see that says free healthcare. And most people say, well, I thought VA was free anyway. Well, what this means is that those veterans have now 10 years before applying to be service connected. And so being able to be seen at VA, not worrying about a priority group, and therefore not worrying about a copay. So yes, in VA healthcare, there are some veterans who do have a copay, and that could be for medications and certain other benefits that they may have under healthcare as well. And so veterans who have not deployed to a combat theater may be also eligible to enroll in a veteran health care because they have that service-connected disability, or they are qualifying under other factors. And so we see Purple Heart there as well. And a lot of that is really, when I talk about the priority groups, determined by what we call the means test. That's basically sharing your income information, and then the system will determine what priority group you fall within, unless you're service connected. It'll determine what priority group you fall within, and basically a copay may be based off of that information. So we still have our Women Veterans Program here at our Dallas VA, and also at a clinic that we have locally at our Fort Worth VA. We say that because a lot of our programs and a lot of services that we have for women veterans, some extend outside of VA, like maternity care, because that's not care that they would be able to receive at a VA hospital. But we also do have like trauma recovery and then family planning as well. Any questions about anything that I've stated so far? I cannot see the chat here.
There are no questions at this time, Andrew.
Okay. One of the things that I want to also share is that with what we call Mission Act, and this is something when we were invited back that we want to just kind of break down and share with you, that when we talk about enrollment, we're talking about being seen at a VA hospital or within a community if you're sent by VA, or at one of the clinics. One appointment in 24 months allows you to stay active in the system. Again, only one appointment. That could be a vaccine, that could be a physical, that could be just a follow-up appointment. But one appointment in 2 years allows a veteran to stay active in the system. Why is that important? Because it then also gives you the added benefit of what we call the Mission Act, which is being able to get service or seen at urgent care within your community and an ER anywhere across the country. This is an ER that is attached generally to a actual hospital, making notice that you are a veteran, them maybe asking for your veteran ID, which VA healthcare provides, and then also utilizing our call center to make sure that once the bill is generated, it does not go to the veteran, it will automatically be sent to the VA for the VA to cover that cost. For urgent care as well, unless you're in a priority group that has a copay, you will able to visit your local urgent care. We'll have the information after this session as well about websites you can go to, put your zip code in, and find out about the urgent care services right in your neighborhood that you can access, also receive your medication prescription for, and be able to utilize that to get any prescriptions that you might receive. And so I wanted to give that information just as a brief overview of veteran healthcare here in North Texas. Mr. Price, are you available?
Yes.
Okay. If you give me 1 second, Okay, Mr. Price. I don't know why this is continuing to come off for us. Okay. Okay, Mr. Price.
Okay. Okay, there you go. Yeah, good morning, everyone. Like Ms. Lewis said, my name is Alonzo Price. I'm a retired Navy veteran, been here at the VA North Texas Healthcare System roughly 18 years come June. And I work in the EEO office, but I'm also the Minority Veterans Program Coordinator. And Ms. Lewis, in addition to being outreach specialist here for VA, she's the alternate Minority Veterans Program Coordinator. And I was gonna brief over that part if you can go to the next slide. The MVPCs, the Minority Veterans Program Coordinators, was established under the Center for Minority Veterans, and this is the agency under the Secretary of VA that establish and identify and do public outreach for minority veterans in the community. So this was established in 1994, and we as MVPCs throughout all three administrations, the NCA, the National Cemetery, the VBA, and then the VHA, the Healthcare Center, we all have MVPCs at each station. Next slide. We serve directly under the director for each administration. So me and Ms. Lewis meet with the director to talk about any barriers that may be existing and get any information from leadership as it relates to providing services to the 40 county that we serve and our interactions with the stakeholders that we have here at VA North Texas. So we are not operating in a full-time position for MVPCs. We both do this part-time, and in addition with our primary role that we have here for VA North Texas. So you see there we support initiatives and activities that educate internal staff. So we also train internal staff on the needs of minority veterans and and help break down any barriers that may exist as it relates to them receiving the education and services here for VA. We also assist the Center for Minority Veterans in disseminating information that is passed down to our veterans in our catchment area. Uh, these are some pictures of some of the outreach events that we do as MVPCs. We do targeted outreach, but we also do, as you we are doing right now, we do outreach for any entity that would like to partner, have the VA come out and provide services and let them know, the latest information with the VA and any other information that they may need. Next slide. So our office is the MVPC is not an equal opportunity office, even though I work in EEO. So that's not my role as an MVPC when I'm out in the community. Me and Ms. Lewis, we don't handle employment issues for veterans. That's not our role. We're not a claims officer here at VHA. We would point those veterans in the right, family members in the right direction, assisting them with a VBA rep that can assist them with their claims need if it's dealing with that area, or if it's dealing with NCA, the cemetery. We would reach out, make that proper handoff to our counterparts with the cemetery. And we're also not an employment relation office. It's dealing with employment issues with HR. That's not our role as outreach individuals. Next slide. So what we do mainly is educating veterans, emphasizing enrolling into the VA, making sure that veterans and family members are educated on their benefits, benefits that may be available to them, going out in the community, providing this information. We have great support from our leadership and doing this mission as it relates to going out, providing outreach events, within our areas, our catchment areas. Our leadership support us in these efforts. We disseminate information that's designated or for those veterans that we're targeting to reach at those specific events. Next slide. So in our outreach efforts, we also brief the director and leadership on those needs whenever we hear anything that may be going on in a particular community, some barriers or some concerns that veterans or our stakeholders have. We advise leadership on those issues and ways to address it, and receive feedback from leadership on how to move forward as it relates to addressing those barriers. We also conduct a minimum, we try to conduct a minimum of 40 to 60 hours of outreach quarterly in our community. That's the goal for MVPC. We also collaborate with the other MVPCs as far as NCA and the VBA in these outreach efforts. So we'll make sure that we're not missing out on any opportunities to reach veterans in the community. So we collaborate, very well with them to make sure we're at those events. We also collaborate with our internal staff here on events that may be going on in the community that they may have. We definitely support the initiative that happens within the VHA, so to make sure that we have a presence at those events. Next slide. Any questions as it relates to the MVPC? Ms. Lewis, someone asked for a copy of those slides. So
We will have the recordings.
All right.
Really good.
Okay.
Yes,
All right.
and I
we'll
can
have
share that with
recordings.
Kimberly as well.
Okay. Thanks.
And there are a couple of questions that came in asking about how are the VA benefits impacted by our employer provided health insurance, specifically related to the ability to get prescriptions or visits to urgent care or ERs.
How is their private insurance impacted?
It sounds like, well, they're asking about how the VA benefits are impacted by our employer provided health insurance.
It isn't. Now, whenever you're enrolled in VA, you generally will be asked the question if you have any other insurance. That will be the time to then share that information. What happens is anytime you are being seen, say you present to the ER, from the ER, unfortunately, maybe you are then um, 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 sent to the ward for any continued care. If you are admitted at that particular time, within the few days that you are there, if VA has a bed open at their Dallas campus, then they will then make notice with that hospital. If you have your own private insurance, you can elect to stay then in the location that you're at, which would then be filed from that point be filed under your private insurance, or you can elect to go to VA. For any other care that VA is actually sending you into the community for, VA covers that. There is a point in time if there is, say, with your third party insurance, they may then, if you provide that information to them, they may then reach out to your private insurance to ensure any overage that maybe you received from a visit that wasn't covered by VA, that they get that information so that you can have that to move forward. But anytime VA is sending you out to community care, that bill is coming back to VA, not to your private insurance.
Thank you so much for that. The other follow-up questions were whether or not you have a presence at the local DAV chapters, and if folks can receive assistance online, or does it have to be in person?
Well, DAV, so we work with pretty much any of the accredited VSOs. DAV is one that we have a great relationship with, meaning that not only do we refer into our Veteran Benefits Administration that's here today, we'll also refer veterans to their county, but also to DAV, American Legion, VFW. What we most importantly try to do is make sure that whoever they're being referred to and the relationships that are established or with accredited VSOs, those that we know have received the training necessary to move forward with filing a claim for a veteran.
Wonderful. Yes, and I think Mr. Price was also adding some other details in the chat. Thank you so much for answering that question. And then that follow-up question was whether or not you can receive assistance online or it has to be in person.
So there are different, so we have a TVC which is Texas Veterans Commission, where you can also receive care face-to-face in office or online. Just as with our VBA, we have offices across the Metroplex from Fort Worth VA clinic all the way into Arlington private location to the Dallas VA that you can meet face-to-face by appointment or by walk-in appointment. And so it's really up to what you feel may suit you the best. As with DAV and others, they also have their own ways of being able to service the veteran and how that works for the veteran. And each one of those chapters may vary.
Understood. Thank you so much. That was all the questions right now.
Okay. And so we'll have our Veteran Benefits Administration, Ms. Beverly Robinson, who is also a legal administrative specialist with our Waco Regional Office. Ms. Robinson?
Hi, good afternoon. Can you hear me okay?
Yes, ma'am, we can hear you.
Thank you. I'm public contact, so we are the offices that you can walk in. We provide benefits, we assist with the claims, we provide resources regarding many of our other VA programs. So what we're going to talk about today is eligibility for service-connected disability compensation. You would come in, file your initial claim. We suggest that you do head to toe for your initial claim. And what we look at is your injury or disease incurred or aggravated by your active duty service. Seriously injured or very seriously injured. We also have benefits at discharge of 140 installation support services for MEB and PEB processes. We also speak with our active reserve duty Title 10 and our National Guard. Important thing is while you're in the service or on active duty is if there is an injury, to go to the doctor, to go see your medical so that there is documentation. So the disability compensation is a monetary benefit paid to veterans who are disabled by an injury or illness that was incurred or aggravated during our active military service. The amount varies with degree of disability and number of dependents. Payments are tax-free when VA pays 10% and higher. The disability ratings is anywhere from 0% to 100%, and payments start at the 10% to 100%. You can receive additional allowance for dependents once you are rated at 30% or higher. We have pre-discharge claims. When that is, if you're within 180 days of discharge, you come in to a 526Z or an 0819, which is IDES. You need to have your service treatment records, a Veterans Claim Assistance Act signed notice response, and known date of separation. If you have you usually don't have your 214 at that time. Other benefits we have is individual unemployability. It is based on employment history, current employment status, the reason for unemployment, and current service-connected disabilities. That is if you're unable to hold a job based on your service-connected disabilities, it can pay at the 100% rate. Even if you're rated at 70%, you would still be paid at 100% if IU is granted. SMC is an additional amount of money that is incurred for loss of use of specific organs or extremities that is just added to your rating decision amount, monthly amount. Go ahead. We have DIC is for our survivors. It is dependency and indemnity compensation. It's a monthly benefit. It is for surviving spouses of veterans that die on active duty training, or inactive duty training, or veterans who die as a result of service-connected injury or disease. Veterans who did not die as a result of a service-connected injury or disease, but were totally disabled by a service-connected disability for at least 10 years prior to death, and also release at least 5 years from the release of active duty, or 1 year before death if you're a former prisoner of war. Who is eligible for the DIC? It's your surviving spouse, child, or parent of a service member who died in the line of duty, or a survivor who died from a service-related injury or illness. And this is able to be a tax-free monetary benefit. This is based on the veteran's service-connected compensation baseline. The veterans pension, the non-service connected pension, our veterans can apply. It is monthly payments to wartime veterans who meet certain age or disability requirements and who have income and net worth within certain limits. The income-based benefit for veterans who are permanently and totally disabled and unable to work due to non-military related conditions. Purpose is to bring the veteran's total annual income to a level set by Congress. What does permanent total mean? That means you have to be age 65 or older, under age 65, but deemed unable to work based on your medical evidence, or residing in a Medicaid-approved nursing home. Who is eligible? Your basics is that you have been discharged under other than dishonorable conditions. You have served at least 1 day during a wartime. Some of the older Veterans have to at least serve 90 days of active duty. Now, since 1980, it has to be at least 24 months of active duty or have completed the entire tour of active duty. And then it is based on your countable income and that you meet the net worth limitations. There is other following criteria: the age of 65 or older, permanent and total non-service connected disability. The patient is in a nursing home due to mental or physical incapacity. You are receiving Social Security disability benefits. Next slide. There's also a non-service connected survivor's pension, which is for the surviving spouse and unmarried dependent children of wartime veterans who meet certain income and net worth limits set by Congress, which is basically the same. They have to meet the three basics under the veteran of honorable discharge, 1 day during wartime, and the time limit that they served. Then their income, the survivor's income, is considered.
Thank you very much, Ms. Robinson. Are there any questions?
I'm not seeing any at this time.
Could I also throw in there that VA.gov is a very good tool. You can go on VA.gov and find a lot of information. You can get the forms, you can submit your claims, you can come see us to submit your claims, you can mail them in. It gives you a lot of information. It's a very good tool. Thank you.
Thank you again, Ms. Robinson. So no questions. Amanda, are you on the call?
I am here. Can you guys hear me? I had to dial in.
Yes.
Okay, perfect. Well, my name is Amanda Selly. I'm a cemetery administrative specialist with the Dallas-Fort Worth National Cemetery. I couldn't answer the poll earlier, but my husband is an Army veteran, and I have worked for the VA for 10 years, 4 years here at the National Cemetery. And so today, I think we're just going to talk about the eligibility and kind of the benefits that we have out of the National Cemetery side of things. Our eligibility follows the same eligibility for veterans health care. You must be discharged under a condition of other than dishonorable. You must serve your minimum 24 months if you were enlisted after 1980. And for our reservists and our National Guard members, they are eligible to be placed out here if they are not service connected from their time, either in their active duty training or anything like that. If they've served 20 years of their reservist or National Guard time, they are eligible for placement out here. And if they passed during an injury from active duty training or during that duty training time, they are also eligible for placement at the National Cemetery. There are also additional members of the family that could potentially be eligible for burial at the National Cemetery. If the veteran's surviving spouse or the spouse of a veteran is eligible to be placed with their spouse, their veteran spouse here at the National Cemetery. If both decedents or both spouses are husband and wife are both veterans, then we can actually place each service member, each veteran, in their own grave site, and we would reserve the next spot so that they could be placed side by side to each other. But each person receiving, obviously, their own military honors, their own grave site, their own headstone, recognizing their own time in their service. Also, dependent children under the age of 21 are eligible to be placed with their veteran family members here. if they are a full-time student under the age of 23, they have eligibility. That child has eligibility to be placed here. And if a child is an unmarried adult child that is incapable of self-support, providing the right medical documentation of that medical need prior to the age of 18. They also have eligibility to be placed here. We do, in those circumstances, if a child was placed before the parent, we would reserve the next gravesite over from that child so that the family can be kept together, stay together during their, when they all come out to be placed. There also are certain circumstances when parents of an active duty member who has been killed either in their service time or from injury or illness during a hostile time, if they have no other surviving spouse or children, there is a very special circumstances for Gold Star parents to be able to be placed next to their children at the National Cemetery. We don't see too many of those out here, though. This is probably preparing for burial, preparing for that time is not a conversation that anybody likes to have. We get this question a lot. It is probably the question we get the most. And the best thing that you can do is to advise your family of your wishes. Let them know that you are a veteran, you wish to be placed at the National Cemetery, whether you want to be cremated, placed in a casket, and we actually are now have a green burial location as well. So we have some options for that placement in a National Cemetery. Have all of your documents ready and available for your family. Give them an extra copy of your DD-214, marriage license, any medical documentation if you have a child that would fit that criteria for to be placed with you. We do encourage funeral home prearranging. Is if you do a funeral home prearrangement, they will actually keep all of those documents in that contract, and it is very helpful. Upon passing, the funeral home will actually contact the National Cemetery Administration and take that burden off the family and coordinate military honors, coordinate the scheduled time at the National Cemetery. And so they take a lot of that stress off of the family if you have the ability to do any prearranging through the funeral home. There is also a form through the pre-need eligibility that you can submit also with a copy of your DD-214 and a copy of your marriage license or a copy of that medical paperwork for a adult dependent child, and those forms were sent directly to our National Cemetery Administration office in St. Louis, and you receive a letter back that says you are eligible, your family member is eligible, but we don't do like a reservation. So once you get that letter, it does state your eligibility, but we don't put a grave site aside for you at that time. We actually don't do any gravesite assigning or any of that type of work until death has actually occurred, and we are contacted by the funeral home. We can go to the next slide. And there is the pre-need determination form, VA form 40-10007, that you would submit to the National Cemetery Administration with a copy of the DD-214, and then a response. That letter is sent to you within about 60 to 90 days. If for some reason the veteran or the family member is found ineligible, you do have the right to appeal. And there's very few instances for ineligibility. Some of them would be not having the military time, that minimum requirement, or committing a heinous crime. And then the next slide. So the burial benefits, what we provide, or what is the benefit from the veteran or for the veteran and their family member, is the burial plot, burial location. We do casketed burials in ground. We do cremation burials in ground, and also cremation burials above ground in what's called the columbarium. We also have location here for green burials, but we don't have that spot utilized yet. The opening and closing of the gravesite, the government grave liner for caskets, your headstone or your marker, the perpetual care of the gravesite, the burial flag, memorial flag, and the presidential memorial certificate, military honors, and a committal service are all done here at the National Cemetery. Your time here when families come to the National Cemetery for a service, they all kind of stage or line up at the front of the cemetery in an assigned area, and then they are escorted in a procession to the committal shelter, which is like a really large stone gazebo. It is covered, it has one wall, but it is open aired. The military does the military honors at those locations only. Military honors consist of taps and then the flag fold, and presentation. Retirees are also eligible for the 3-round rifle volley. And for veterans that don't qualify for the retired rifle volley, there are other organizations such as your VSOs, your auxiliary honor guards that will also provide a rifle volley for the family. And then of course the memorial flag is presented, and then after that that committal service, which is your family time for thoughts, words, prayers, and things like that, the remains, the casket or the cremations are taken to the burial location. And then they're able to be visited every day of the year. We're open 365 days a year during all daylight hours. So you can visit whenever you would like to come. And then it looks like there is our website for any requests. There are portions of the families can request for compensation for portions of the of costs, such as there's finding the right words, special compensation for reimbursements for things like caskets or funeral home costs. They are not dollar for dollar, they are a stipend, but veterans who are service connected and pass from a service connected condition are usually eligible for those. But those forms can all be found under the benefits administration and be sent to them for processing. And we are having a Memorial Day ceremony on Memorial Day, the 26th at 11 a.m. And so you guys are all welcome. Everybody is welcome to come and pay their respects that day and be part of the ceremony.
Thanks, Amanda. Any questions?
Yeah, we had a couple come in on the chat. Can a veteran be placed next to a parent who is already placed at the DFW National Cemetery if they're in connection to a different veteran?
Not typically. And that's just because we do all of our burials sequentially. And so chances are that the burial location right next to the parent who's already been placed here is probably taken by another person. There are it never hurts to ask when that time happens, but chances are that section will not be available to be placed right next to the parent family member.
Understood. Thank you. And if a vet died in 2018 and was cremated, would they do military honors when the remains are buried, or no, because has been too long?
So, did the veteran, I guess my question would be, did the veteran not have military honors when they passed away? And are they here? We can always do a memorial service. So if a veteran passed away, they did not have them when they passed away. Okay, so we can do a memorial service here. You would just need to call us the national number, which is 800-535-1117. 800-535-1117, and just explain that you would like to have a memorial service here, and we can do that. The veteran does not need to be placed at our cemetery for a memorial service to take place, and they would receive the same type of service with the military honors, the committal portion, the flag fold, everything. They would receive the same benefits, just obviously not the placing because they are elsewhere. But we can do that at any point in time.
Perfect. And another question came through. This is for local Arlington Cemetery, but does it include the one in Washington? This information, I'm assuming.
Correct. This is the Dallas-Fort Worth National Cemetery. The Arlington National Cemetery in Washington, they are actually DOD, and they have a little bit different rules than we do.
Perfect. Are there certain days or times of day for the burial services?
Yes, burial services are Monday through Friday only, and we do burials as early as 9 o'clock in the morning, and the last casket is at 2:30. The last cremation placement is at 3:15.
Wonderful. Next question. Can a spouse and veteran be buried together or next to each other if they both are veterans?
Yes. The first person to pass, we would reserve the gravesite right next to that first burial location, so that when the second person passes, they would be placed side by side.
Good to know. And I think the last one I have is, how long does it usually take to schedule a service at the National Cemetery after notification of death from a funeral home?
Typically about 10 days. It's pretty quick. Fridays and Mondays book up the fastest. Just because cremations can be booked out so far in advance. And so Fridays are a little bit harder, but usually about 10 days if the family is able to do a service on a Tuesday, Wednesday, Thursday.
Wonderful. That's all the questions I'm seeing at this time.
Okay. Well, thank you, everybody.
Thanks again, Amanda. And huge thank you to each of you who have joined us today. If there are any other questions for any of the other presenters, we'll also take those. We have time to take those as well.
I think I saw one earlier during the transition. I believe this one was for Ms. Robinson about whether or not T&P can be downgraded.
So it said TMP. Are they talking about when they get out of the military, and sometimes they are temporarily permanent, and that then eventually turns to permanent? Or are they talking about when we grant 100% permanent total, is my question. If we have granted 100% permanent total, and if there is a new claim that comes in that is for some of the same conditions that we have granted, they go to their CMP exams, there is improvement shown, yes, we send out a due process letter stating that we have been notified of improvement of whatever condition has been claimed, and give them certain times. Several letters go out, but then also that veteran can come in to appeal, bringing us new information showing that no, this condition has not improved.
Thank you so much. And switching gears a little bit, if your GI Bill has expired and you didn't use it all over the years you were active, could you file a claim to get the years that the benefits weren't used to have them extended to be used for your education currently? And who should you contact if you have further questions?
I would say the Education Center, because we have different, we give basic information on like home loans and the education, but in the VA.gov, if you use that, you can go on there. There is a box of education. You click on that and you can contact the education department. Ours is located in Muskogee, Oklahoma. So the best way is to ask that over the VA.gov.
Thank you so much. Oh, we got one more that just came in regarding GI Bill. So if you paid into the Montgomery GI Bill but never used it, do you get that money back?
I don't know that answer again. It would be through the education department. I've never heard of that happening, but like I say, we only give out the basic as far as the education. That contacting them is the most reliable information.
That makes sense. Go straight to the source. Absolutely. The only other question I'm seeing is, got the GI Bill contact information, contact number. It just got put in the chat. So check that out when you get a moment. Yes, this presentation will be shared. We won't be sending it out. We're going to be putting the recording and the slides up on our VRG website. And if for some reason that doesn't happen, then yes, we will email it out to everybody so that you have it available to you. But I just want to thank everybody for your attendance today, and thank you for Andrea and your team. This was wonderful. I did want to let all of our attendees know, all of our BRG members know that this was just sort of the start of a series of different sessions we would like to hold with Andrea Lewis and her team. We would like to find out more about what specific topics you would like to see over the next several months. If you want us to talk about the PACT Act, if you want us to talk about, GI benefits, if you want us, educational benefits, etc., let us know. You can throw something in the chat right now, or you can email me directly, kimberly.jones@utsouthwestern.edu, and I'll be happy to, make a list, take it back to my events and communications committee, and we can get these sort of vet talks scheduled for the future. But again, I want to thank Andrea Lewis and her team. Oh yeah, you see Hazelwood. Everybody wants to know about education benefits. I love it. So and the GI Bill, fantastic. Thank you so much for those suggestions. And Andrea, did you have any other comments or?
No, other than, again, thank you. We look forward to, as they are sharing what they would like more information on. It'll give us an idea then who we can then go and make the request to be here, and specifically what questions they may have, so the presentation can be really formatted for the information that we don't often get or know. Especially like some of the GI Bill questions.
Yeah.
And if you get your money back, because I was waiting to hear that answer as well. And then again, like reiterating things that we knew but may have been updated like within the last few years as well. Certainly. So we'll look forward to coming back.
Wonderful. Yes, you are definitely invited back, you and your team. And Ms. Robinson, did you have a question or additional comment? Nope, she was just kidding.
Hold on. Yes.
Okay.
The Hazelwood Act is actually a state benefit, and the best people to contact on that is Texas Veterans Commission. That's
a good note. Keep in mind. Yep. Fantastic. We got additional information going in the chat right now. So this was wonderful. Thank you again for everybody in attendance. Thank you, Ms. Lewis and your team. And we'll see you all next time at the next Vet Talk. Everybody have a wonderful afternoon.